Some people may find it hard to think or talk about the end of life. But especially in patients with dementia, it is important to have these kind of conversations early on in the course of the disease. Near the end of life, the patient will no longer be able to make their own decisions. Planning ahead often results in a better experience at the end of someone's life, not only for the patients, but also for loved ones. If you've heard of euthanasia and assisted suicide, but you're not completely sure of the difference between them, don't worry, you're not the only one. While both euthanasia and assisted suicide are intended to end someone's life, there's a distinct difference between the two. Euthanasia is the act of intentionally ending someone's life by injecting a substance into a patient who is seeking to end his or her own life. Worldwide, euthanasia is legal in 8 countries. In Belgium, Canada, Colombia, Luxembourg, New Zealand, Spain, the Netherlands, and several states of Australia. Belgium has the most liberal euthanasia law. It is not just for the terminally ill, but also for patients with psychiatric conditions and even for children. Euthanasia is allowed for those with unbearable suffering and no prospect of improvement. During multiple discussions with the patient, the doctor has to seek reaffirmation that the patient's suffering is truly permanent and that the patient's death wish is persistent. When it comes to euthanasia and dementia, the problem is that patients with advanced dementia can no longer express their own wishes, and it becomes difficult to convince the doctor that the patient still has the cognitive abilities to understand their decision to die. In most countries, the law prohibits euthanasia when patients lack the ability to express their will. This is why people with dementia are pushed to end their lives earlier than they wanted, while they still have their decision-making capacity. This raises the question, should a previously expressed wish for euthanasia be respected? This is a difficult and complex area. You can write down what your fears are, what you don't want to experience, but it's a wish, it's an expression of fear, and people's wishes may change over time. When I talk to friends about aging and disease, they often say, I'd rather die than go to a nursing home, or I'd rather die than live in a wheelchair. But it often happens when we get older, and people always find a way to cope. That's actually a beautiful thing about being human. This is also the underlying reason why doctors must always check if euthanasia is still the patient's wish. And with late-stage dementia patients, this is not always possible. Since April 2020, doctors in the Netherlands may legally euthanize patients with severe dementia, even if they no longer express an explicit wish to die. The patient should provide a request in which he specifies the conditions determining when he wants euthanasia to happen. This issue is highly controversial. Let's assume that your mother has made a written statement in which she clearly states that she wants euthanasia from the moment she no longer recognizes her children. The doctor has to determine whether your mother's actual situation does indeed match the circumstances specified in the written statement. This is extremely difficult and puts a heavy burden on doctors, because even carefully formulated specifications about the chosen moment of death require interpretation. How do you define recognizing someone? There are many ways of recognizing a person. And what if a person with a written statement offers resistance when the action is performed? Where should we draw the line? While euthanasia is only legal in a few countries, physician-assisted suicide is more widely accepted. The fundamental difference between euthanasia and assisted suicide is who takes the life of a person. With euthanasia, a doctor ends a patient's life by injecting a lethal drug, whereas with assisted suicide, a drug is prescribed that the patient himself must take in order to die. And one last thing, a question people often ask is, why do people with dementia want to die earlier? They won't remember the suffering. Well, research shows that it comes from wanting to maintain the autonomy over their own life. It may feel like a way to regain some control. A patient once told me, if I cannot control the illness, I can at least control how I die. Thank you so much for watching this video. If you liked it, please give it a thumbs up.